This is the Authority Company podcast, conversations with leaders that are designing our future. Hola, I'm Joe Pardavila, and it sometimes takes a true outsider to disrupt an industry, and that certainly describes my guest today. Her name is Kara Trott. She's the author of the new book, No One Alone, Humanizing Healthcare as an Outsider. We're going to talk about how she became an accidental disruptor, the long-lasting impact of quantum health, and how an outsider can humanize healthcare. Kara Trott, welcome to the Authority Company podcast. How are you?
I'm good, thank you.
Well, Kara, I have so much to get to, and I feel like I've been talking to like a lot of folks in the healthcare industry recently, and it's one of those things where I don't know if it's like American. Remember that saying from like 2008, like too big to fail? Like healthcare, is it too big to fix? I know it's a big, broad question to discuss, but give me your thoughts when you hear about when people say they just kind of throw their hands up in the air. Can't do anything about it. It is what it is. Can healthcare be fixed?
Well, first of all, thank you for having me. I'm really excited to do this. And I think the answer to that is segments, pieces can be fixed. There's no one silver bullet that will fix healthcare. Um, One of the biggest challenges with healthcare is if you think about the whole sector, you have healthcare benefits, you have, delivery of care, which is providers, and you have, all the medical devices and things like that. And then those things are all delivered to people. And some of them are delivered, through self-pay because people don't have insurance. Some care is delivered through, Medicaid or Medicare or both if somebody's got a highly complex condition, or commercial. And commercial involves both commercial insurance for small employers who offload their healthcare expenses into a carrier, or large employers who self-fund their healthcare and just use you put together a complement of people who pay claims and things like that. So our selection is that one of the things that can be fixed with healthcare, and we embedded it in the self-funded market, is helping people who are healthcare consumers get through the journey in a more safe and in an efficient manner. And I think one of the challenges is if you try to fix everything, it's just so many different sectors, so many different places. It's very, very hard and it is overwhelming. But if you sort of look at, if you have competency in a particular sector, you can actually fix some very important things in that. What I noticed, and I was not a healthcare person, so to me, it was a very interesting question to say, can something in healthcare be fixed? What I notice is that for the people who are going through a healthcare experience, and so we call these healthcare consumers, they might be patients, but a patient is only one piece of it because they're also insured because the company is paying their claims and everything. But they're people who are going through a journey that includes a whole lot of different things happening to them. And my observation was that one of the areas that can be tackled using strategies from consumer goods and services industries that are highly focused on consumer journeys and experiences, that when a person finds out they have a healthcare issue, and I'm older, so I'll use my own analogy from my days in college. They're dropped like a ball into a pinball machine, and that lever is pushed and popped, and they're bounced around, and every time they hit, one of those little things, the points
Bumpers.
go up on the board, right? Yeah, and bumpers, right? And points go up on the board, and those points are expenses or outcomes or things like that. And what I observed when I was working with provider organizations was that we just let that happen. There's no organization to it. And people don't choose a healthcare journey, so they're not good at it. And they're suddenly thrust into a world where the language is different. To providers, you're a body part. We're going to fix this. We're going to do this. And even great providers, they can't impact anything outside the treatment area, diagnosis and treatment. Insurers, you're a claimant. A claimant, that means that you are a dollar, right? So you're either a high cost claimant or you're an incidental claimant, whatever it is, you're a claimant. That's so depersonalized. And all of the services that exist in a classic traditional insurer that might help people are actually just geared toward like utilization management and things like that. are geared toward keeping risk down. So they're all about, should we pay this? Should we pay this? That's what they're looking at for you. Should I pay your claim? Nobody is sitting there looking at, what is this person going through? Do they even understand anything? Who's coordinating all these pieces and parts? Because then you have the innovation side of healthcare, which is just all the different services that are offered that are really changing a lot right now. So my view was that you're dealing with in healthcare, one of the challenges you're dealing with is what I would call a very classic consumer pathway problem. And by the way, this is not new. All sorts of other industries understand consumer pathways, figure out how to address them, figure out how to intercept people at the earliest possible point in their journey to help them get to their product or use their service, or put solutions together for them. This is not new, but healthcare industry is incredibly insular. It thinks it's special. Just like you said, is it too big to fix? Well, it's not if you look outside for, how do other industries fix this? And I thought, I had worked in consumer goods and services and retail, and I had done, studies of how people move through a store or move through a buying process with cars or use banking services, etc. And there's a tried and true method to understand a consumer journey, and then to develop insights about where can you impact that journey. And I thought that if you did that in healthcare, you could actually produce the same kind of result that you reduce in consumer goods and services and retail, which is, every time we did it and we understood it and we executed on it, the pilot stores or the pilot projects would get a 20 to 30% increase in, like, for a store, same store sales. That's huge. And my view was, if you could understand the consumer experience as a journey and figure out where they get stuck, where the impact points were, what kind of services you need to be able to address that, and how would you even know someone's on the journey, right? Because they don't show up anywhere, right? Maybe at the doctor, but sometimes the journey starts well before then. Um, then how would you know? And my theory was is that then you could work with the person directly and all these entities that interface with them to make the process more efficient and effective, make people feel loved and cared for, because they do not feel that along their journeys. And if you did it right, you could reduce costs, because everything I saw when I was working with providers is that all these missteps, all these bumpers, it's all crazy. Nobody knows who's doing what to whom. You could make the process more efficient. You could solution for people, because only a small percentage of their issues actually relate to the healthcare treatment and diagnosis. A lot of them relate to what I call life adaptation issues or claim issues or any number of things. So it's so multifaceted, it's very complex. But you can make them feel loved and cared for. And all these missteps create opportunities for people to get worse, not better. You could improve their outcomes. And that was my theory. And that's, what I studied for 2 years. And that what I learned from that study formed the blueprint for the company that I founded, which is what the book is about. So,
That's awesome. And you kind of alluded to the subtitle of the book, which is Humanizing Healthcare as an Outsider. So let's
yeah.
go back a little bit. Tell me about, and you've kind of like hinted here, but tell me about your background in legal and marketing. How did that sort of skill set equip you for this? And I think you always hear, I think a lot of business, let's get outsiders' opinion on this. Why do you think the work that you put in to your sort of your sweat equity and all the knowledge you built, why do you think you were prepared to tackle something that, generally you were just not involved with on a day-to-day basis?
Yep. That's very true. So, kind of going back to, so I graduated from a liberal arts college with a degree in politics and government and philosophy. So in
Wow.
1983, when inflation was double digits. So I was just like, and my dad said to us, you all can go to graduate school, but I'm not going to pay unless you work for at least 5 years, because I'm not going to pay for you to avoid trying to get a job. So I graduate. I was equipped, I always say I'm equipped to do nothing but think and study problems and how people might think about things. But fortunately, I found a job where thinking was advantaged, and it was in market research. And the firm that I joined had just created this market research division. They had primarily done, they were an international firm, and they did store design, merchandising strategies, and kind of distribution strategies for large retailers or consumer goods companies. But they were finding that their designers would go in and just say, chartreuse is the color of the year, so we're going to do the building in chartreuse, and we're going to put these products here, and there was no real science behind it. And so they thought that there was an opportunity, and actually some professors from Ohio State University kind of informed this. There was an opportunity to focus instead on, what consumer attitudes were, to instead consumer behavior, because the belief at that time was that, and it's true, behavior causes your attitudes. You have to rationalize what you do. So I came into this firm, and I started my job doing the research, as a research person, like, compiling all this stuff, analyzing it. Then I moved on all the way up in the firm to where I was actually leading the projects and then translating the insights into action for our clients. And, I worked with major companies. Ford was one of them, Citibank was another. I worked on a Kmart project and whatnot. So I got to see a whole lot of things, and it was a really young firm, and it was very strong, and so it was a great experience. But then I was like, okay, is helping Kmart sell more blouses really what I want to do with my career? Because I had to make a decision. Do I stick with that, or do I transition over to something else? And my intent in getting a politics and government and philosophy major, having those majors, was that, I would be well equipped to go to law school. And I didn't really know what I would do in law school, but my dad and I thought, we kind of plotted it out, and thought I would probably be pretty good at that. So I went back, went to law school, graduated, started working for a larger firm that actually had a large healthcare practice. And when I applied, I went after I interned there, they ask you, what areas are you or are you not interested in? And I said, I'll do anything but healthcare, because my experience had been in business, and my dad was a architect, a well-known architect, and I had been, I'd worked when I was in high school with him, so all my experience had been in business. I had no experience in healthcare. And actually, when I went into the firm, I ended up working in the corporate department on a whole lot of transactions and wind up of hostile takeovers and finding people who'd stolen money, and repatriating it back for the institutional investors that we represented. So it was really a kind of very heady time. But, we know what happened with healthcare in the early 90s when Bill Clinton got elected and Hillary Clinton decided to take it on. And because the firm had such a large practice, um, it caused panic among their clients. Their clients were all the hospital systems, about 80% of the hospital systems in the state of Ohio, and kind of a little region surrounding Ohio where borders were crossed. And so all these health systems started panicking, like, we need to do something. We need to do something. We need to form these managed care entities. We need to come together. We're going to have managed care imposed on us. And managed care had this thing called global capitation, where we're only going to get, like $100 per member per month. And we're going to have to deliver all these services within it. We don't know how to do this. And so the healthcare department needed a transactional attorney to come in and start putting all these deals together. So they asked me if I would provide some support there, which I did. And then they decided that, they not only needed to put the deals together, but they actually needed to advise the clients on how to think about it. And then they look around the firm, they're like, who has any experience with consulting? And the partner that was tasked, they created a consulting entity. The partner that was tasked with that said, well, Kara Trott does. I was like, so they're like, Kara, would you work in this consulting entity, and would you go out and figure out a reason for it in managed care? So again, not being a healthcare person, I think, was an advantage because I didn't know the lingo. I'm not bound by the way things were done, but was spending hours with physician leadership and hospital administrators thinking about, like, what do we do different in managed care? How do we do things? And as I always say, I kept hearing, when they would riff off into these bad patient stories, like, "Oh, this person went to you and they should have come to me and then I told them to do XYZ and they didn't do it. They ended up doing all these other things." And I kept listening to these stories. I was like, well, doesn't somebody help people? And all I knew was that, insurers had like utilization review. I knew that they had these pieces. I was like, doesn't that help people? And they said, no, that's just so that they don't have to pay us. They want to make it hard for us. And 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 the truth was is like it wasn't really interacting directly with the patients. And I listened to this and I was like, it sounds to me like what exists in healthcare is what I would call a very classic consumer pathway challenge. And there are tried and true ways of understanding it and fixing it. And so I started asking all these questions and it was very clear that everybody looked at me like I had a third eye and they're like, "What do you mean?" We just fix where, cancer. We just fix this. We just fix that. And I was like, "Oh, Lord." I said, "There's a huge opportunity here." So I talked to the systems that I was working with about it, and I said, "What if we did a study and the study told you precisely how to actually develop processes to work with people?" And they're like, "That'd be awesome." Because, from what I could tell is that the most trusted person in healthcare was the doctor. So I'm like, "Oh, maybe they could do this." And I know how to get at the answers. And so I told the firm, I said, "I think there's an opportunity to do this." And they're like, "Well, is it gonna lead to legal fees?" I said, "Well, I don't know because I think it's more about processes than who owns who." And like, "No, we're not interested in that, but could you use, lawyers to do your research?" I'm like, "No, no, I would use, professional people who do this stuff." And they're like, "Well, we don't wanna do this. Here's what we want you to do. We want you to create transactions that we can then do and use the firm." And I was like, "Well, I don't think the answer is in that." And they're like, "Well, you know, that's okay. You're only a few months from partnership anyways." I was pretty close. And they're like, "You're not gonna give that up. Come on." And I was like, well, this seems like a really interesting challenge. And I think I know how to get at understanding it. And I don't know exactly what the solution is, but I'm pretty sure that, like everything else I've done, is if you love the problem and you understand it and study it enough, the solution will become evident to you. And I'm pretty sure I could figure that out and execute on it because I've done that before. And I'm never gonna be less valuable as a lawyer. So I said, "See you." And 2-year-long research study before I even started the company, but a 2-year-long research study that really still to this day is the blueprint and the structure of what quantum health is. Which what I found that was interesting were 2 big things. One was that the place to embed this was not in the provider. The provider has little or no visibility on what the patient does once they leave their office or once they have the procedure done. And hospitals have none. They're just think of hospitals as a big facility that just puts things, equipment in that doctors use. And they do support patients while they're in the hospital, and they're great places for that. But they don't have, again, they don't have any visibility once the patient leaves. Who knows what happens to them? And where a lot of the challenges are is when the patient's not with the doctors and not with the hospitals, when they're outside of it. And and the place to house things where you actually can see what's happening is the insurance. And the employer insurance particularly I've thought was good because our interest is aligned with large employers' interest. They care about their people. And if in a self-funded world, if we're able to reduce claims, they keep it. It's huge. It's right to their bottom line. It's one of the few areas where you can drop a lot of money to the profit line with zero pain because if you had to lay people off or do all sorts of organizational efficiency things to get the kind of savings you can get from your claim spend, you would only recoup you'd have to do twice the amount of work to get it. So it was So that's where the idea came from. It was based on research, but also in the health plan, all the information that you would need flows right through there to be able to trigger connection points.
That's awesome. What a great story. Thank you for sharing that. And it's funny because I think of all industries, the one that doesn't like outsiders the most is probably healthcare. Like the idea.
We're very unfriendly.
Yes. So, and just, if you care to share, like, what were some of those early interactions where people kind of like, really, like, a little cross-eyed, wait a minute, wait, what does this person know about healthcare?
That's exactly what it was. Oh my goodness. Oh my goodness. So, when I was looking at creating the company after, we'd done all the research and I knew kind of the blueprint for it, um, my attorney who actually was helping me set up the company, he took me and I had a guy who came from the law firm who was working with me. Um, so he's like, I'll because the first question is, how do you finance something like this, right? When I was in law school, my father died, and unfortunately, suddenly, but I had some inheritance from him that would allow me to go a period of time without an income. I mean, I was married at the time too. My husband had a very good income, so and I had my mentor who had been the CEO at the consulting firm that I worked with. So I knew I could get some angel investment, and my partner who came from the law firm, he got some too. So I could go a while without it. But our lawyer's like, "Oh, I think I can introduce you to some, venture capital people and stuff." So I go meet with them and they sit there in this room and they're literally like, I gave them the idea and they're like, "You're never gonna make it. Here's why. I'm gonna tell you why, blah, 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 blah." I went out and done this whole thing, and I just sat there, and I was like, "Well, do you work in healthcare?" "No." I'm like, "Okay." I mean, I sat there and I listened, and we went out, and the attorney is like, "I'm so sorry about that."
Wow.
But, oh well, and I'm like, "Well, we're not getting money from them." So, anyways, so I self-funded it, and yeah, I mean, along the way, lots of people were sort of like, "You can't do that. Providers will never work with you. Plans will never work with you." But there was a pathway because, it probably would be a lot harder now, but at the time, there's the employer segments. So one of the things that happened is three of the health systems who I was working with, I worked with eight of them. They were so interested in it that they said, why don't you see if you can take theory to practice? We are large, we are self funded. So if you can produce these results on our plan, that will be your proof of concept. And so I did have 3 clients, so I had a little revenue stream. Wasn't enough, but it was a little bit of a revenue stream. And then, I just proceeded to go out and start talking to employers. And I figured, in the self-funded space, there's a whole lot of segments, right? So you have smaller groups that might be 1,000 or fewer employees. You have, kind of the mid-market, which would be 1,000 to 10,000 employees. Then you have the large group, which is 10 to 20,000, and then the jumbos, over 20,000 employees. Ultimately, we wanted to get to jumbos because, they kind of feed you, but actually what I noticed was that pretty quickly in the mid markets, and I found some people who, sometimes people, when you're new and interesting, they come to you because they think they can advance their ideas. But I did meet some people who had some insights and who could, advance my idea a little bit, at least contribute to it with knowledge that I didn't have. And one of them was that in this segment of, say, under 10,000 employees, and particularly like around 1,000 employees, they were served by independent third party administrators, not owned by carriers, because carriers would kill us. They would just never work with us. And there were all these independent networks. So now, fast forward today, you couldn't do that because all the networks are owned by carriers, and the carriers now have third party bought all the TPAs that now serve this group. But at that time, we had about, I would say, 10, 12 years where we could go under the radar screen. Because that was one of the things because I didn't know healthcare, I felt like we had to prove our concept. We had to prove that we could get the savings and the results that we expected. And then we could decide how to enter various markets and how to disrupt the in-force carriers, because that those things are behemoths. They're not friendly to outsiders. We In order to do our model, we remove key parts from them. So we take over all the customer service, we take over all the provider services, and we take over all the clinical, which puts them in the position of literally just paying claims and providing a pre-contracted network. So
Wow.
they don't like that. They don't like that. I didn't want to poke the bear without I felt like if we could get the clients to do that, and I didn't really at that time understand the fact that this is an intermediated market also. So you have benefit consultants and benefit brokers kind of taking things to employers, which at first were not friendly either, except for those that thought it was a competitive advantage. So we kind of linked up with some of those. But getting to have like a Willis Towers Watson or an Aon or Mercer, somebody like that support you, is you have to have a lot of proof, and they have to have a client who's, like, almost desperate that's willing to try something new. But it gets you your proof of story, your proof of concept. So my view was that the proof of concept was going to ultimately come, and I learned enough from various people in the industry that to prove that we were causing cost reduction required a certain base of people being covered for a period of time, 3 years minimum, that we could say it's not just good luck or bad luck. It's actually by design. And so it took me until 2006 to get that base. That's a long time.
Wow.
Go from 1999 to 2006. So, that's 7 years, and we had enough, and I was looking at bringing somebody in to help sales. He was coming in as an advisor who had been head of Aon's consulting practice. So he had basically hired all these people, and they were now populated not just in Aon, but Mercer and all over the place. But he was gonna kind of evangelize on our behalf, and he's like, "Well, not only have to have the data that you've pulled internally, because I'm being a researcher, I am a little bit geeky, and I used to be a really great spreadsheet Jackie. I lost that skill, but he said, "I want it externally validated by someone who the market will see as credible." So we retained the guy who had been former actuary at Humana, who was now, I think at that point, he was doing some work for the Brookings Institute, and he was super well respected out there. And
Wow.
have him review our data and see if he could discern, was it luck, or was it by design and intent? And so so in 2006, I had breakfast or lunch with him, and he sat there and he's like, "I'll do this," but he says, "I'm just telling you, I think you just had good luck. I've never seen anything like this work other than the fact that you're just hitting it at the right time." And I said, "Well," I said, "I guess you'll tell me that. I know what it shows, but I'm not you. I don't have your credibility."
Wow.
So we sent him all this data and everything, and he came back about a month later and he said, "Okay, it is not just luck. You are, in fact, causing a change that would not have happened without for your being there." And he said, "And here I have isolated some of the factors that prove that you're consistently doing this by design and intent." And he said, "This is powerful." And then he became one of our advocates. And then we've done that kind of thing every year since then. So we still go out to get independent validation. But I believe that it was that I would not be able to ask clients, if it was just a good service and it was nice. I mean, that's always something nice, but it wouldn't withstand the challenges of a high cost year, or a year, where there was a lot of aberration in their claim experience. And it certainly wouldn't bolster clients to go say to their carriers, "I'm going to have this firm come in and do this work because they have this special expertise in consumer behavior. And I am going to take these functions away from you because those are the enabling areas that enable them to get these results. And I'll pay you a little less, but you'll still be my network. Um, I didn't feel that you could ask clients to do that, to be disruptive, unless you got exponentially better results that were credible and repeatable. And so, with that, then we were able to go out and really start building the business.
Wow, that's fantastic. It's funny you said 7 years. Just so you
Mm.
know, and you probably know this, Kara, it took doctors 25 years to adopt full use of the stethoscope. So think about it in terms of progress. Seven, I mean, to you, it might have felt like an eternity, but 7 years in the world of healthcare, my lord, that's like a blink of the eye.
Well, I think as we were dealing with people, with consumers, and we have a special expertise that no one else has. And we're adding a competency. I say we're additive. Like you need so insurance companies are by their very nature transactional units. They survive and their economics are based off of processing a large number of transactions accurately and correctly and making sure that they don't spend money that shouldn't be spent on behalf of themselves or their clients. Providers are, they're just in the business of delivering a service, right? A very, specific service. In our industry, you have the digital players who are about digital solutions that it's all about a user experience. It's primarily a user experience. What we're bringing is a whole different competency. It's a consumer competency, and it's really a very intimate relationship that we have with all of the people that are employed and covered by our employers. So you'll hear me refer to them as consumers because that's generally what they are. But in the context of whether they're working with us, they're members. So they're members of our clients' healthcare plans. They're getting their health insurance for them and their family members covered through the employer's plan because we get paid by the employer. And there's a competency around how do you help people in a most bewildering time of their life get through this journey safely and effectively and solve all these other problems for them so that you can help them save money, help the employer save money, help them feel better and get better outcomes and feel really cared for during the process, which is one of the most awful times in life. That's a unique competency that we are bringing to this industry that is needed. We entered through a pathway that had, lower barriers and multiple ways to get to it and many at bats with, the clients. It's still the sector that we serve is still the largest out there. It serves 60%. It's only 2 to 3% of employers in America, but they cover 60 plus almost 70% of people covered under
Wow.
commercial under employer-sponsored plans. And we'd like to get
Wow.
into Medicare because that's huge, but that takes a slightly different pathway, but
That's
equally.
awesome. What a wonderful story. I mean, and it's amazing. It's funny. So a friend of mine started this company from scratch and was like literally scratch, like was selling products out of tents, and it became this multi-million-dollar bed and bath product place.
Mhm.
And but the one thing that she hates is being CEO. Like she wants to be the person who like rubber stamps big decisions, be the visionary, and I've noticed that you've sort of stepped away from the CEO seat to go into the chairman seat. Was that and again, I don't want to put words in your mouth. Was that sort of your feeling as well? You're like, I don't want to do this certain role anymore. I love this company, it's mine, but I just don't want to do this actual job anymore.
Well, yes and no. I mean, I loved being CEO of my company because, the big pieces of being CEO are, setting the strategy and the vision, setting the culture. Culture is very big at our company and kind of, setting a decision structure that works. And I felt like I was very competent at that. It was not my training. I'm an accidental entrepreneur. I wouldn't have gone and sought out a CEO, but I'm pretty sure had I stayed in the practice of law, I probably would have been managing, tried to be managing partner or something. So I was always kind of pushing for leadership roles. Not I always ended up in leadership roles is a better way. I mean, why did they ask me to lead this consulting practice? They saw the same kind of traits and so I didn't I loved it, but, so at the time that I left, the company, so it was 2021. So the company was 22 years old, but my journey had been 25 years because I did 2.5 years of work before I started the company. And I was, at an age, so I wasn't 12 years old when I started the company. So I was at an age where it was like I was slightly older than the age my father was when he died. And I had watched my dad, he was just rising to, a high, high level with international visibility of his work when he died. And I watched my dad just work so hard and not be able to reap the benefits of what he had created and the things that he was doing. And I felt like I didn't want that to be me. I didn't want quantum health to be my entire existence. I wanted quantum health to be a great thing that I did and that it is going to be excellent no matter what my role is in the company. But I also felt like technology was changing, and that this is even before AI. The needs of technology in the company were changing. I'm not a technologist by nature, although I will say AI is much more intuitive for people like me with liberal arts degrees and law degrees because it's all about the questions that you ask, right? But old technology is about the ones and the zeros and the blah 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 blah. And I could see that we were hitting a place where what we had to refresh our technology, and technology, is a huge enabler for our business. It's not the primary way we interact with members because it's just healthcare is so confusing. People can't even articulate what their problem is, but it enables our healthcare warriors to do that work. So and I felt like I had done a really good job of bringing up leadership inside the company that I trusted and that I would still be able to sit in the chairman's role and do what you're saying, contribute to vision, guide the company, um, and then as, founder, you have this depth of knowledge. So I was like, I'm still going to be an advisor. I just don't want the day-to-day reporting to me. I mean, the company was very large. I mean, the company is very large. I mean, I started with 5 people. It's now over 2,400 people. So it's very, very large. And a lot of moving parts and it's done really well, but it's like I did not want the company to be beholden to me, and I didn't want to be beholden to the company. I was ready to kind of change my work style and everything. So that was my decision. And when I did a recap in late 2020, and I had told my prior investors who ended up coming back, they stayed in, they rolled more in 2020. I had said to them about a year before this, I do not want to be the CEO for the next iteration of this company. So when we go out next time, which we thought was going to be 3 years later, but the next time, I do not want to be positioned as the person that they should rely on to get the next return for them.
Wow. I mean, it's remarkable self-awareness because, as you probably know, Kara, in your journeys, most CEOs once they get that seat, it's way too comfy to
Um,
give it up. So good on you on that.
I mean, it's consumes your life. I mean, I was traveling 70+% of the time. It's grueling. It is grueling, and it's a huge responsibility. And in a company that's growing at the pace that quantum health grows, you're really creating a new company every 2 to 3 years because it's growing at that pace. And it's hard. It's hard, and the next generation needs to step up and lead.
That's awesome. That's great. I always wrap these conversations up, Kara, by taking folks behind the dedication of the book, and you dedicate the book to your parents, who obviously been a big impact on your life. But one line that stuck out to me was, "To all the warriors at Quantum Health." First of all, tell me about the idea for using the word warriors. It's not you tend to see in business, but first, why dedicate to them, and tell me about give some background about the word warriors.
So, why dedicate to them? So, the warriors are our healthcare warriors who are dealing directly with the consumers along their journeys. And, they do really hard work. So, calls come in from them, calls come in for providers or, however things come in with new technology. And, what we're asking them to do is to listen, not just to the question that the person's asking, but what's behind the question and to exhibit empathy because, you know, for example, a member may call in and say, I need to know if this doctor's in my network. The answer that you would get in any place would be very kind by well intended people, very good people who would say, yes, this doctor's in your network. Get the member off the phone. Move on. You answer their question. In our environment, they might see that this doctor happens to be an oncologist, and they would say, yes, this doctor's in your network. Can you tell me a little bit more about what you're going on? And in that moment, the person might reveal that, well, I'll give you a great example. They'll reveal that their husband just got diagnosed with terminal cancer and they're trying to adapt to it. And there's all sorts of things that can be activated right in that moment. So we ask our their their original title was care coordinators. We ask them to take the time and understand and empathize with the person what they're going through, but also anticipate their needs and bring expertise in. Like this person is, are they at the right physician? Are there other options available to them? What else is happening in their household? Because sometimes, this guy's the main wage earner. It's going to disrupt a whole lot of things in their household. What else are you worried about? Now we also want, because this is going to be an extended, very complex journey, we want to get a nurse involved to work with this person and help them understand what the doctor's saying, because a lot of times people don't understand what the doctor's saying, understand what the diagnostics are going to be, understand what the treatment is going to be. They're going to need nutrition, they're going to need all sorts of things. It's a complex journey, and those get started right then and there. And all from this one simple question. So when we started growing, we decided in 2013. So we implemented in 2007, 2008 was the first year we implemented. We realized that our clients really need very. We need to be experts in our specific client's plan and all the assets and resources they have because. Like for cancer care, many of our clients will have a totally separate fund that will give additional support to families for their deductibles and copays and things like that during a cancer journey. There's all sorts of resources, community resources, and there's also resources under the plan. So each client plan is different. No client is, Delta is of our clients, and their plan is very different than Abbott Labs, which is another client of ours. So we have to be experts. So we divide it into small teams called pods, which there's science behind that. But because we wanted to make sure that when that call came in, that people actually ask the question. Well, if you get a huge call service, call operation, people become anonymous and they won't do that. Our magic depends on doing that because the changes that we make in that journey that occur at the very beginning of the journey are the ones that produce the financial results and the better health outcomes. So we started with 2 pods, but by 2013, we had a lot. I don't even remember what we had, but we were going past the stage where one, you knew everybody, two, everybody just kind of knew how to do it to where you had to actually hardwire it. So I had realized that we're asking people to make discretionary decisions on the front end. So the example I gave you is a good example because we're relying on a customer service person who received that call to be able to know who else is available to plug in and what else this person might need. We're relying on their discretionary decision making. Nothing is scripted. So if you're going to do that, then, I want to make sure that the people at the front line would make as good a decisions or better decisions that I would make if I were doing that. And the only way to do that is to ground them in your brand values. So we did this research around what is the value that we're actually delivering to people and how are they, what are the things we need to make sure our people do to match up to what the consumer needs and the employer, by the way, and everybody. And we discerned from that, and we talked to people who had us, people who didn't have us, what their experience was, et cetera. It was kind of it was a different study from the original one I'd done. But what it clarified was that, what people needed was they needed sanctuary when they call in. So we have 5 pillars. Sanctuary would be one, a safe place to explore whatever is on their mind. We're not going to ship them to a different person. We're not going to say, sorry, I can't handle that. Oh, my 1 minute and 30 seconds of talking to you is over. I've got to get off the phone. So they need sanctuary. Secondly, if you allow them to open up that question, the second thing they need is immediate expertise. You can't disappoint. You have to be prepared. And our thought pods and the teams are thoughtfully put together to be able to have all the expertise available to that warrior in that moment if they need it, or, we'll follow up with them. Um, Third, you have to stick with them. A healthcare journey is a long journey. It's not short. Fourth, you have to use these conversations to build trust and friendship with the person. They have to be able to know they can rely on you. And fifth, and this came out in the study, what people want us to be is like, so imagery that came out was Yoda or bunnies with guns. They want us to be warm and cuddly with them and kind, but they want us to take on the system for them. They want us to go out and get stuff done or get shit done. They want us to fight the system and make sure that the right thing happens for them because they cannot do it themselves. And the imagery that came out from the consumer experience was one of Dorothy being dropped in Oz, where they're bewildered. The familiar is unfamiliar. You're told, go down this path to your new normal. It's fraught with, the lions and tigers and bears and trees throwing their fruit and the flying monkeys, all sorts of bad things could happen to them. And it's scary and it's bewildering. And people lose their executive functions in these times. So they need somebody to do this work for them. So we came up with the concept of healthcare warriors as kind of the defining persona of what our people are. And they really relate to it. And we're all actually in our company, we're all warriors, whether we're doing that work directly, or whether you're supporting the work, in our organization, leadership is inverse. Like me, the CEO, is at the bottom, and our executive team, we're here to support all of this other work that's getting done. The front line is the most important because if it doesn't happen with them, it doesn't happen, and the company isn't successful in its mission. So that's where Healthcare Warriors comes from.
Awesome. I love it. Her name is Kara Trott. The book, No One Alone, Humanizing Healthcare as an Outsider. It's available now. Kara, thanks so much for the time. I really appreciate it.
Thank you. Thanks, Joe.
And that'll do it for this episode. If you want to find out more information about Kara and her other amazing authors, go to theauthoritycompany.com.